So what is RETP? And it's a little bit difficult to describe because you can go to a course on communication, how to communicate with your patients. You can go to a course on treatment planning, just dedicated treatment planning, or it might just be on ortho or how to do procedures faster. You might go to a course on how to talk about money. But when we're doing this with our patients in real life, we're not communicating and then we're treatment planning and then we're doing occlusion and then we're discussing money. That's not how dentistry works. In dentistry, we do all of those things simultaneously. We're constantly talking to the patient about the cost of procedures, about how the treatment plan affects the cost, how the treatment plan affects their goals, how their goals affect their cost, whether we can meet their goals, do we need to compromise? We're doing this simultaneous juggling act all the time. And so I don't teach you communication or treatment planning or how to talk about money or how to do an examination in 5 minutes or 2 minutes or how to take a set of photos in a minute and a half. I don't teach you those things as separate things. RETP, we do it like real life. We do the whole lot at the same time. It means that it's harder to sell it to you because I can't just tell you this is how you make money, this is how you treatment plan better, this is how you communicate better. I'm trying to teach you all of them combined as you would actually do it with the patient, with them in your office. So I want to teach you how to do your examination faster, more efficiently, better. That's the goal, isn't it? Doing something better and faster. I want to teach you how to document better and faster with less effort from you. I want to teach you how to increase the size of your treatment plans, not because we want to sell the patient more, but because we want the patients to be healthier. Often health is something that the patient has a whole bunch of other things in their life that compete with their health. They have electronic goods, they have holidays, they have all these things are competing with their health, and sometimes the patients make the wrong choice. They choose to buy a phone or they choose to go on a cruise instead of being healthy, and then later they have regret. So we want to help our patients not have regrets. So that means sometimes we have to sell them health. We have to be effective at selling them health. I find that the average dentist who does my course, their treatment plan acceptance goes up significantly. It's not uncommon for their production to go up significantly. That's not the goal of my course. My goal is to make you a better dentist and have happier patients. And a side effect of that is quite often that our production goes up, our treatment plans go up, our acceptance rate goes up. I want to help you look at the whole patient. How do we do it in a general practice? We have so many patients coming through the door who just want TLCs, tiny little treatments. They want to have one tooth fixed, they want to have one implant done, they want to have one filling done. And then coming along with those patients is the occasional patient who wants something more. They want their mouth fixed, but they can't tell you that so easily. No one comes in and says, look, I want a full mouth of crowns, or I want a full mouth of recession surgery, or whatever. So how do we sort in the general practice from the flow of all the regular patients who want regular stuff, these 1 or 2 patients once a month or once a week or how often, who do want comprehensive care? See, that's a tricky balance. Some people think your practice is either full of big cases or it's full of small cases. I find that most people who do big cases also do lots of small cases. The big cases are like the cherry and the rest is the cake, okay? So that's what I want to teach you, is I want to teach you how to improve your acceptance rate, improve your communication, improve the satisfaction of your patients by more closely meeting their goals, to improve your ability to talk about money, to improve the comprehensiveness of your treatment plans that consider all aspects of the patient, not just the most obvious thing, and how to take that patient who has one broken tooth or one issue and teach them that there are many other things, and to help them accept maybe a better long-term treatment. Or more importantly, to make you and the patient happier with less regret about your treatment. It's easy to make stuff happy in the short term, but making a patient happy, making yourself happy in the long term, or dentistry without regret, that's what we're after. So RETP is like real life. We talk about money, we talk about treatment plans, we talk about the types of treatments, we talk about different types of clinical scenarios, we talk about how we do stuff faster and better, and we talk about it all at the same time, which is what we do in real life.